Hi, my name is Jessica and this is my daughter Kalia, and I have a question for the doctors. Every time I have to take my daughter to the doctor's office, it makes me really nervous because she ends up getting sick. I know there's a lot of bacteria and germs in doctor's offices and hospitals, and now there's a huge Ebola scare going on. Is there a way for me to get my daughter's prescriptions without having to physically take her to the doctor's office and expose her to all that bacteria and germs?
Great question. Well, we have just the thing for you, Jessica. Now you can have a team of physicians on speed dial with the app Doctor on Demand. And Dr. Pat Basu joins me with some answers to Jessica's questions.
Thank you. Good to be here.
So, you know, she's expressed some concerns that I think a lot of people have right now.
Absolutely. Unfortunately, it's all too common. There's, believe it or not, 2 million hospital or healthcare acquired infections in the United States every year.
2 million?
Yes.
Basically
exactly.
Meaning someone shows up at the hospital or a clinic and gets sick.
Exactly. And 100,000 people, will sometimes die from that. So it is a huge problem, and it's such an inconvenience and such a wait. It is 3 weeks on average now to get an appointment with the doctor. When you leave your door from your house to go to the doctor's office, or from your office to the doctor's office, studies will show that it takes on average about 3 hours of your day. It's a pain. It takes a long time. And with telemedicine, we've treated literally millions, tens of millions of patients over the last several years. And my favorite part of Doctor on Demand is seeing the patient comments, hearing that we made their life so much easier, so much better. And 95% of the cases are treated during that video visit itself.
So basically, if someone logs in, they talk to you, they can get a prescription, they can get a doctor's note, they can get pretty much treated for whatever is ailing them.
Absolutely.
So Jessica, is this something you think you'd be interested in?
Definitely, for actually a variety of reasons. I'm a single mom who's always on the go, so for me to take the time, as the doctor said, out of my day to schedule this appointment to bring either myself or my daughter into the doctor's office, I mean, all of that on top of actually going to the doctor and potentially getting sick. Also, I have a long history of staph and MRSA, so me going into the doctor's office or a hospital is that much. I'm not a huge germaphobe, but when I go into the doctor's office, I am, because I don't want to touch anything. Because that's where the most bacteria and germs, we pick it up, and for me, it's hard for my body to fight that off, so I don't want to go to the doctor's office.
If you don't have to.
Right.
So is there a Doctor on Demand 24 hours a day, or is it
There is. 24 hours a day, and across the entire nation. In fact, we've actually had a couple, about 2 to 3% of our cases actually come in from Americans traveling abroad, where they're in China or Europe, and they get sick and they don't know where to go, and they'll call for advice. When you're abroad, we can't give you a prescription like we can here, but certainly we can tell you what to do, what not to do.
Fantastic.
Exactly.
Thank you so much, Dr. Basu.
Thank you. Thanks for having me.
Yeah, and best of luck to you, Jessica. So this is a pretty cool app from our executive producer, Jay McGraw.